Good afternoon. My name is Mohammed, and I come from Garissa County. I'm one of the volunteers associating with Red Cross. I'll give you a short story on how I started my journey. I come from the deaf community, and back in 2020, when COVID-19 came about, we, as the deaf community, we didn't have any information at all. This started from the deaf schools. We never had anything, straight from the social media, from the radios and everywhere. We were not aware at all. So because I'm a bit exposed here and there, I saw this is quite of great concern, and there was quite a big challenge, not only in my community, but specifically for my county, Garissa. So I approached Red Cross to be able to empower me and support me with different equipment like masks and everything. So people really never understood, and especially I have quite a huge number of community who they first heard about COVID-19 from me. So what I did together and collaborating with Red Cross, we noticed and we had statistics of quite a number of deaf people who are suffering straight from our deep in the villages. If you are aware of Garissa County, our land space is very huge, and actually we are not that developed at all. So we'll find that I would travel for 5 kilometers just to give this information. When I looked at our government, there was no much help that were coming in, especially for the deaf people. I really tried to advocate through Red Cross, and I also approached different government bodies like the county government, national government, who continued and were not supportive for the deaf people. For instance, I remember around that time, everyone was running to the hospitals. When you go to the hospital, there are no interpreters. When you want medication or any specific diagnosis, there was no one, and everyone could literally run, us being stigmatized by lack of interpreters. The deaf language itself, it's a barrier to us. And also we have COVID-19, which was a huge giant that everyone was seeing everyone and running. So we really experienced stigma. Also, we have cases like gender-based violence. Among the deaf community, it was quite very high. People thought that deaf community don't have challenges in marriages or families, but we really experienced this at all, this a lot. So we also went to the hospital. We could go to the police stations. It was not easy. And I remember there was one woman back in one of the villages, interior of Garissa town. The lady had a baby who was 4 years old. Because of the family issues that we were suffering, all of us, especially lack of jobs and different challenges that we experienced. So this deaf lady was told to go to the shop and source for food from whichever office. So this deaf lady left her 4-year-old at home, and the parent told was not associating with the baby. So this 4-year-old baby went to the interiors of isolated field, and there we have quite a number of animals. So yes, the baby was hearing, but a 4-year-old don't have sense of judgment at all. So the lady went, and he was eaten by the lion. But you see, this is also one of the discrimination. Despite you being deaf, you find that we are discriminated in our own home. So as deaf community, we were not happy because we said that also the family was discriminating the girl. And this is because probably it might be, we can say the deaf girl did not inform the parents due to the communication barrier or something. And also another empowerment that I've really done, I've advocated for this girl, and now she's working with the county government as one of the dressmaking officers with the county. Myself, I have a family as well, and my wife is deaf, and I have 3 beautiful children. All of them are hearing. So you'll find that these things are not easy, especially for us deaf people. In terms of communication is one of the big challenges. And communication, I can say, straight from the national government to the local administration, the chief and the likes, that is one of the big challenge. But I've seen that with working with the Red Cross and the talks that you are experiencing right now, I can see that we are really getting support, and collaboration is one of the key to eliminate the barrier that we are experiencing, and also seeing on how we can be able to help one another. I remember around that time when we were being given masks, we never had even the funds that the government were issuing for persons, or maybe 6,000, sometimes 2,000. As deaf, we never experienced such funds. So, and then it was lack of this, again, I repeat, communication barrier. For example, you see like Monica is voicing. You will find that without interpretation and probably voicing and everything, no one can understand what I'm trying to express. So that was one of the huge things. I want to finalize with a recommendation, how I've been thinking and the miles that have come. So if only the government can employ sign language interpreters, let's say in the hospital or in any public office, that will really be of great milestone to persons with disability, especially us for the deaf. You find that office chiefs, these are the community that everyone in the community go, if not only empowerment, but how can we be able to solve this? You find that we lost quite a number of deaf people due to misdiagnosis, due to lack of nurses and doctors not being able to understand us. So maybe employment of interpreters in these public spaces will be another good way on how to solve. I think that's all for me. And I'm happy standing here and inviting me. It was indeed short while standing here, and I'm happy.